Good afternoon, everyone, and welcome to the Multicultural Media Online Forum, where we will have Minister for Health, Brad Hazzard, Minister for Multiculturalism, Natalie Ward, and our Chief Health Officer of New South Wales Health, Dr. Kerry Chant, to answer your questions. We will have Natalie Ward, Minister Natalie Ward first, and unfortunately, Minister Hazzard and Dr. Chant are held in some meetings, but we'll have them here soon enough. We'd like to first, of course, acknowledge the traditional custodians of the land where we're all meeting today. And we are in the Eora Nation here in New South Wales Health Office in St. Leonard's. Would also like to acknowledge the elders of past and present of the multicultural communities that are present today. As you may know, we will be taking off our masks just to make sure that we're able to express ourselves, and also just because for those who are hearing impaired that they can see clarity, or who may need to lip read. So every day we will take off, when we do these media sessions, we will take off our masks when we're on camera, and when off, we will wear our masks. So just letting you know. So shall we start? Also wanted to let you know to please keep your microphones on mute and make sure that you have your questions on the chat. We have 45 minutes today. And again, we thank you for being here. So we'll pass this on to Minister Ward. How are you, Minister Ward?
Hi, Jesusa, great to see you again. Thank you so much. I'm great, and I'm really pleased that we can come together again to have this conference again today. It's really important given the messaging that we need to get out through all the multicultural media channels. So thank you very much for having me, Jesusa. You happy for me to kick off?
Yes, please.
Wonderful.
Any updates do you have today?
Yeah, lovely. Thank you. So I also acknowledge the traditional custodians and elders past, present and emerging. For me, that's the Gay and Margal people, and I acknowledge elders in each of the multicultural communities as well. Thank you so much. Again, I just want to say, given today's numbers and given the information that we have to hand in the last 24 hours, how critically important each of you are in getting the health messages out through each of those channels. I want to thank you again for your commitment to conveying those messages. In whatever format or channel it is, it's critical that people hear from you. Now, I can say as a politician all the health messages, but when communities hear in language, in their own channels, whether it be their newspaper of choice in language, whether it be on the radio, and they hear those health messages through your channels, they will take them seriously. And they will support those health messages, as so many have been to date. It is absolutely critical that we get the vaccination as soon as we possibly can. It is safe. It is safe to get it, and it's our first line of defence against this deadly disease. We've seen a tragic death. All deaths have been tragic in this pandemic, but most recently with a very young person. We know that this disease does not discriminate by area or by age. So please, if I can commend to you, as you've done so well, walking alongside us in this journey, to convey to communities to get the jab, get it as soon as possible, and otherwise stay home as much as you possibly can. That is our best protection, and that's our pathway out. It's our pathway to freedom. We've put our funding from the New South Wales government behind each of the multicultural organisations, media organisations, and can I once again just commend the package to you. It does close tomorrow, and the reason for that is we want to get it out as quickly as we possibly can. So please do apply. It's quick and easy to help support you doing what you've been doing so well. And again, the package that I announced yesterday, Stronger Together, getting that essential food hampers and medical and help out to those groups that need it. I also want to thank you for conveying the translations and the translated messages, which are so critical as well. And finally, I just wanted to emphasise that I really appreciate the opportunity to have this discussion. It's a two-way discussion. To get that feedback from you on those questions is so critical as we pivot our response and make sure that we're doing everything we possibly can. And so we know we can be innovative in some of these things. We know we've done that already, and that is through the process of hearing from you and communities about what we can do best. So again, thank you for the opportunity. Please convey, stay home and get the jab as soon as you possibly can. It is our best way forward. The first vaccine is the best vaccine. It's the one that keeps us safe and protects our family and our loved ones in our communities. Thank you, Jesusa.
Thank you, Minister Ward. We have received word that Minister Hazzard and Dr. Kerry Chant will are on their way and they'll be here shortly. But we have one question, and we want to thank everyone for sending through your questions. To Sally Roberts, our media director here in New South Wales Health, and for sharing that information. And we know that there are a lot of questions, and also please share that on the chat. Here's a question, Minister Ward, from Rachel Crew of Epoch Times newspaper. Many people refer to Pfizer, but it looks like it's not available. She's actually attached a photo from Hertzville. What is the concern of people who have concerns over AstraZeneca? And how do people report if they're charged for taking jabs?
Thank you, Rachel. They're excellent questions. First of all, can I say that to me, the first vaccine is the best vaccine. So whatever vaccine you can get, please emphasise that the sooner you get that jab, the safer you, your families, your loved ones and your communities will be. I'm certainly no health expert, but I can say that I've had the jab, my husband's had the jab, and I have made an appointment for my son to get the AstraZeneca jab next week from our local pharmacy. So I just can only emphasise that it's really important that we, with this new Delta strain, that we all go and get, as soon as we possibly can, the first line of defence. And as for the question about people being charged for taking the jabs, I'm sure that Minister Hazzard will have much more to say about that, but it's not the case that they should be able to charge for that. There are free jabs available from the health clinics, and I know I've been out to Homebush and it was fast and easy and friendly. The teams out there are amazing, and you can book that in online. So I'd emphasise, go to the New South Wales Health website, make that booking, and you can get in there. You should not be charged for that at all. We want everyone to get the jab as quickly and easily as possible. And if you see that, please let health know.
Thank you, Minister Ward, and we'd like to welcome our Chief Health Officer, Dr. Kerry Chant. Dr. Kerry Chant, would you like to give an update?
Thank you, and thank you very much for taking the time to join us today. In terms of the update, I'd just like to say that we're continuing to see incredibly high numbers of cases in southwestern Sydney and Western Sydney, and we also are seeing some seeding events or introductions into other parts. So no one can be complacent regardless of where you live. We've seen overnight the fact that we've introduced stay-at-home orders and closed a number of businesses in the Newcastle area and surrounds in response to some cases in that area. And we've also had cases in Central Coast. And so key message is still seeing cases in that southwestern Sydney, Western Sydney area, into the Campsie, Lakemba areas and into the Georges River area a little bit. But what we're then seeing is that these occasional seeding events outside that area. So everyone is at risk.
And we'd like to welcome Minister Hazzard to the room. Thank you very much, Minister Hazzard.
It's all right. I'm sorry I was a bit late. Lots of meetings today. Apologise.
We were just having an update from Dr. Kerry Chant.
So I just did want to follow on in relation to the vaccination. And I noted that in some of the questions that have been asked are also in relation to vaccination. So there are 2 vaccines available, currently registered for use in Australia, and they are the AstraZeneca vaccine and the Pfizer vaccine. Both vaccines are very effective at preventing hospitalisation and death. So after 1 dose of both vaccines, it takes about 2 to 3 weeks after the vaccine, you have a reduction in hospitalisation and death by about 70%. In relation to a second dose for the Pfizer, somewhere between 3 weeks, and you can have a longer interval, or the AstraZeneca, the minimum interval is 4 weeks, which we are currently recommending. You have a period of time after those second doses, you have a 90% protection against hospitalisation and death. So the vaccines are very effective, and it is critical that we use vaccines against the Delta strain. In terms of complications associated with the AstraZeneca, yes, vaccines, like all medicines, have side effects and complications can arise. I think it's important to understand that with AstraZeneca, there is a rare complication called TTS. It's a clotting disorder. But what also is important is that we don't overestimate that risk of that complication when we have ready access to that vaccine, when we're seeing young people hospitalised and in ICU, and we're seeing tragic deaths. And for me, I suppose what's more important is seeing the experience in aged care facilities, where we've had very vulnerable aged care people who, when COVID's been introduced, have not had serious consequences because they've been vaccinated. So that really reaffirms the strong international evidence about the effectiveness of both vaccines. I'll leave it there.
Thank you, Dr. Chant. Minister Hazzard, would you like to give an update on just your thoughts?
Well, I'll just say this, that it doesn't matter what you do. If you cross the road, there's a risk. But you know that if you cross carefully, you're more likely to get there. And quite simply, using a vaccine, either one, will get you to the other side of the road safely. So make sure that no matter what is said in your community, the health advice and the scientific advice from around the world is take a vaccine, either one or any others for that matter, if they come in the next year or two. But right now, take either AstraZeneca or Pfizer and you will be a lot safer.
Thank you, Minister Hazzard. There is a question from Fatan Aldana from Muslim Community Radio regarding the latest incident of the fully vaccinated health worker who has tested positive to coronavirus, sending dozens of intensive care nurses and medical staff at Westmead Hospital into isolation. People, especially the anti-vax, are questioning the efficiency of the vaccine.
Okay, a couple of points. We know the vaccines work, and I've given some examples in my earlier response to show that they do, but also we have lots of international evidence showing how effective they are. Now, no vaccine is 100%, and we will see cases in people that are fully vaccinated. But what we know is they will have on average, vastly milder diseases, and they will also be less likely to pass it on. So even if they have those breakthrough infections, we suspect they're less likely to pass it on, all positive features. So it is important that we don't overreact when there are cases in that. We would always expect it, because I didn't say that they're 100% and no vaccine is 100%.
Can I just say, look, again, we had last night, sadly, we had to 8 p.m, 5 people die. And 4 of those had no vaccine. One had 1 dose. So unfortunately, the simple message is the odds are that you will have a much worse outcome if you're not vaccinated. Get vaccinated as soon as possible. I can also say each one of us have a responsibility to our family as well. It's not just about us. We're far less likely to get the disease if we have the vaccine, and we're far less likely to transmit it to our mum, our dad, our grandparents, our kids. So if you're taking it for you, you're also taking it for your family. And probably in a lot of ways, I would think for most of us, that's more important.
Thank you, Minister. A question from Vladimir Kuzmin, editor of the Unification Weekly of Russian Community in Australia. Lockdown in New South Wales was around a month and a half ago. With Delta variant, it does not work as good as before. Also, closed international borders helped in a short term, but it's difficult to keep it closed for years until virus is eliminated.
Can I just say something before you do that? Can I just say, Vladimir, I think it's Dobro Jutro or Dobro Den, I'm not quite sure which, but you're quite right. But the Delta variant is still being beaten into submission by the vaccines. They are still doing a very good job. They will continue to do a very good job, but we need about 80% of the population at least to have got the vaccines in order for us all to be kept a lot safer. So my strong message there is, again, just go and get vaccinated. Spasiba.
So we will not eliminate COVID from the world. What we will need to do is ultimately learn to live with COVID. But because of the severity of the disease and how easy it is transmitted, we can't do that safely until we have about 80% of our population fully vaccinated. So that is why we currently need the current lockdown to achieve a slowing of the growth. If we had not locked down and taken those actions, we would have seen skyrocketing levels of cases. And that is why it is so critical that we get our vaccination coverage up as soon as possible. The thing that gives me joy every day is to look at the fact that at the moment we are vaccinating about 84,000 people a day in New South Wales. I actually want to see that surpass 100,000, push up to 150,000, because I know that in the end, until we reach that 80% vaccine coverage, we are not going to be able to control the spread of the Delta strain in terms of going back to more life as usual. So that's my message, which really very much follows on from Minister Hazzard's message.
Yes, we had a question here from Fred Zhang. Recently, we reported a clinic in Campsie charged people $250 for vaccine, and most people are shocked and angry at this. Sydney Today would love to know, what is the health department's comment on this issue? Will this clinic receive any punishment? And how will you prevent similar things from happening in the future?
Fred, can I answer that? Kerry, Chant and I represent the state government and the state health department. We don't regulate, or we work with, but we don't regulate general practitioners. The federal government does that, but both the state government and the federal government agree absolutely that GPs should not be charging anything to give out the vaccine. So I understand that Minister Greg Hunt, who is the federal minister, has ordered a complete review of the situation, and I believe that he's going to make sure that the money is refunded to people who have been charged any amount at all, under basically a disguise of a registration fee or whatever else they wanted to do. It's not allowed, it will not be allowed, and they will do everything to try and stop that happening. And I'm sorry that's happened to anybody. It shouldn't have happened.
Thank you, Minister. Minister Ward, maybe this question is from you, from Adriana Simas of Greek Herald. New South Wales today recorded the highest number of local cases ever since the start of the pandemic. Multicultural communities are worried and concerned. Is the COVID-19 messaging working, and what else do we need to be done to ensure the messages are getting across?
Thank you very much. It's an excellent question. We have been working day and night with your help to ensure that we're getting those messages out there. I understand people are concerned. I understand people want to have clear advice. And I just want to thank all of the multicultural media outlets for partnering with us to get that important messaging out there, because we know that when people hear the health messages in the channels that they prefer, in their newspaper, in the Greek Herald, on their radio station, when they hear the live translations of the 11 o'clock press conference, they will understand that messaging and they will listen to that messaging because it's come through the channels that they know and trust. So that's why it's so critical that all of the multicultural media outlets assist us, as they have done so well in conveying those messages every day and every week. We are constantly listening to ways that we can get the message across, and we're always open to feedback, as I've said at every one of these conferences, and I thank you for the constructive feedback we've received. It's allowed us to pivot, but particularly with the translations of the messages and the health messages daily by the community and religious leaders, that's had a lot of traction, and I'm very grateful that they have been doing that and getting those messages out. And also recently our sports heroes, because you know some of the younger ones in those communities might not listen to their archbishop or might not listen to their imam, but they will listen to their sports heroes, and they certainly won't listen to me if they're anything like my teenage son. So those translations, those messages are really, really important. I just want to thank you. We will continue to do everything we can to get those messages out to every channel in language, to every corner of our community.
Thank you, Minister Ward. Here's a question from Hadil Sabah from Iraqi TV Australia. Hundreds of Arabic community in Fairfield and Liverpool, their ages 60 and above, they want Pfizer vaccine and they're still not eligible to book it. If there's any chance to provide it to them?
So the answer is, in the short term, there is still not enough Pfizer to go around. And my clear message to anyone over 60 is, you are in those communities. Your risk of being exposed to COVID and dying is incredibly high. Do not wait. Please talk to your doctor or your pharmacist about AstraZeneca, and please discuss your concerns with them. But my strongest advice, if my mother was in that situation, would be to get vaccinated. I advised my mother-in-law, who I love dearly, to get vaccinated. My husband, who is 60, just turned 60, to get vaccinated, and he had his first dose of AstraZeneca. So, and I've been vaccinated with AstraZeneca. So yes, I'm not walking away from the fact that AstraZeneca does have side effects. Pfizer also has side effects, but you need to be aware of them and act quickly. But the risk of COVID and this Delta strain will see you in hospital or sadly dying. We've seen people in their 60s die. So do not hesitate and get a vaccine, particularly if you're over 60.
Can I add, we had a 27-year-old gentleman die yesterday. Young people are dying as well or getting very ill. Nearly 70% of all of the cases we've currently had in the last few days, last few weeks, have been people under the age of 40, 70%. And as evidenced by that young man sadly dying yesterday, young people die. If you don't die, you can end up with a lifetime of what they call long COVID, which are very debilitating circumstances. You would find it difficult to get out of bed, difficult to walk, difficult to work. So the short answer there is go to your pharmacy, go to your doctor, or come along to one of our state hubs, one of our vaccination hubs, and get the AstraZeneca if you're eligible. And you're certainly eligible in our state hubs if you're over 18 or over. So as Kerry says, there's a risk with everything. There's a risk with falling off the chair that I'm sitting on right now. But I know that the risks are far less if you've had the AstraZeneca or the Pfizer. That's what these vaccines are designed to do, to keep us safe in great numbers. The majority of us will do far, far better. The biggest number of people will do far better if we have the vaccines, one of the vaccines.
Thank you, Minister Hazzard. There's a question here from Muslim Community Radio. And the question is the government or health department considering the idea of priority vaccination for essential workers who are currently attending workplaces, given COVID transmission among co-workers in the places have been flagged as a contributing factor among emerging cases?
Look, we're weighing up all those issues at the moment, trying to get construction workers back to the workplace. All I can say is watch this space at the moment. The government is certainly trying to find ways to do that, but we also have to make sure, particularly for people coming out of the areas where we know the virus is very intense. So in the 8 local government areas that we've highlighted in recent days, you remember it started in Fairfield and then went out into Canterbury, Bankstown and to Liverpool, but it's now extended into another 5 local government areas. We're very aware that a lot of our very fine working people who help build our great buildings and our great railways and our homes are in that area. And we're trying to find ways to strike the balance to get them back to work, but do it in a safe way. So hopefully we'll be able to make some announcements on that in the next, hopefully a few days to a week.
Thank you, Minister. There is a question here about influencers influencing people about vaccines and AstraZeneca and also about Pfizer. How are we going to be able to deliver messages to them? And there are some that are coming out from Instagram and a lot of social media. How do we get to them?
Can I say there's only one thing that matters, that's the science and the medicine. And the science and the medicine tells us that these vaccines our federal government have bought for us are very safe. There's no point in listening to people who don't understand the science or the medicine. We can all dream up stories, big stories to tell. And if you happen to be an influencer, you get some people to listen to you. My strong advice to each and every one of you would be to listen only to the science, only to the medicine. And Dr. Chant has repeated many times that what we need now is people to get vaccinated. If people don't get vaccinated, they don't look after themselves, but they don't look after their families, they don't look after their friends. And of course, it means we stay in lockdown even longer. We need people to listen to science, medicine, and get vaccinated.
Dr. Chant, it says here that thank you for the opportunity to do this, but what about young people about vaccine, AstraZeneca and Pfizer, especially with the teens and with the young adults?
So in terms of the vaccine is not licensed for use in younger people. The Pfizer vaccine is now licensed for use in that 12 to 16 age group. But in terms of the ATAGI advice, and that's
Can you explain what ATAGI is?
Yeah, I'm going to. That the ATAGI advice is the expert advisory committee that provides advice to the Commonwealth Government. And what they've said is, in the light of the current Delta outbreak, anyone over 18 should strongly consider vaccination. So I would urge, and I've always advocated, to follow the ATAGI advice. So anyone over the age of 18 should strongly consider getting vaccinated, talk to your immunisation provider and have that conversation. And obviously, I'm not walking away from the fact that both vaccines have risks and benefits. It is a normal part of a consultation or talking to a health provider that you take into account all those factors. But also I can just put into perspective, we are seeing very high caseloads, high case numbers, and we're tragically seeing deaths. It is important that we act quickly. The vaccines take 2 to 3 weeks to have an effect. And so there's no point delaying as well. So please, there are many access points for people across the state, particularly in southwestern Sydney, that have been put in place. And I strongly encourage you to take up that opportunity to get vaccinated.
Thank you, Dr. Chant. Wanted to ask Dr. Minister Hazzard, would you like to add to that?
No, just again, I think it doesn't matter. If you've ever been to a doctor for anything, they'll always tell you on the one hand this, and on the one hand that. So if you had an operation, they would tell you, well, look, you need the operation, but there's a risk of this happening. Most of us would have the operation because we know that's what's going to keep us alive. All I'm saying to you as somebody who's been working in this area for a while now, all the medical expert advice around the country, around the world is you need to get a vaccination as soon as possible. But as Dr. Chant said, yes, have a talk to your doctor or your pharmacist and just get some advice as well. But I think when you weigh up the risks are far, far worse if you don't have the vaccine.
Thank you, Minister Hazzard.
Yeah, is it possible for me to add to that? I just wanted to say that I absolutely agree. My son is 18 years old, as I said earlier. He's doing the HSC. We've enrolled him to get the AstraZeneca because we know it's the first and best protection we can get for him. I've put him in for that immediately as soon as I can at our local pharmacy. But wherever you can get that available, please do so, because we know with those younger people who have got the disease and sadly, tragically have died, we don't want to take that risk. So I really want to make sure that we're doing the best we can. I trust in that health advice for my own son, and I can only commend that to everybody else.
Thank you, Minister Hazzard. We have a question here saying that coal communities in regional areas do not have the same level of access of GPs or vaccinations as their peers living in the metropolitan areas.
So there is increasing access through pharmacies that the Commonwealth Government is rolling out. And so I would just say that avenue for access will hopefully significantly increase. I know a number of areas, GP access is a little harder, but the state health system has also set up a number of clinics. So in many cases, access is easier in some of those small rural communities. But we're happy to follow up if there's particular areas. Please let us know where you've got concerns. But on the Commonwealth website, there are a large number of pharmacies that are coming on board in coming weeks as well.
And I think there's about 50 odd pharmacies in the areas. Did you say regional areas or coal? Yeah, there are pharmacies coming online all across New South Wales. There's about 1,250 pharmacies across New South Wales, and we've asked the federal government to allow us to get all the vaccines out to those pharmacies where they are able to give the injections, the vaccinations. So hopefully that will get better in the next couple of weeks and months.
Thank you, Minister. SBS Radio Pasto program is asking, how is the vaccine campaign targeting multicultural communities so far, and what are the main challenges dealing with the communities?
I think we've been very much listening to the concerns, and the local health districts have been making the vaccines more accessible at places where the community feels comfortable. And they've also been picking up on those issues and making sure that health practitioners that speak the language of the called residents are present to take them through the risks and benefits. So I think we've you know, we recognise that there is, the feedback we're getting is there is a lot of hesitancy in the community, but I think it is important that people consider the significant number of deaths we're seeing and the significant hospitalisation and the risk level, and make their decision and rediscuss it. If you've discussed it before and decided not to, I think the situation has significantly changed with the Delta virus. And so go back and discuss it with your pharmacist or your GP and re-engage.
Minister.
I'll just add to that obviously one of the vibrant things about Australia and Sydney particularly is the number of different multicultural communities, but everybody has their own leaders in those communities. So New South Wales Health has been working with a lot of those leaders. Obviously, there are different leaders in each individual community too, but we try to reach out to them, make sure they understand the science and the medicine, and they can then give those assurances to the members of their particular communities. And we also recognise that when you give a message, the message has to be trusted at the other end. It has to be delivered in a particular way, and by the people who are giving it, they have to be people that are just considered highly in their community. So we're trying to work with everybody, as well as give the official advice through Dr. Chant, who obviously doesn't speak those other languages and doesn't necessarily understand all the wonderful cultural aspects, but also challenges. And in so doing, we are seeing people now coming on board and wanting to be vaccinated. There have been areas where the numbers of vaccines have actually been very, very low in the intense areas where the virus exists. So we've been working very hard to understand why in those areas the actual vaccination rates are lower than they are in other areas. And hopefully we are seeing a change in that, and hopefully the only way out is to have vaccines. So hopefully that message will build and build. And I think as more in the community have it, they become the ambassadors for having it, and they'll tell others and their families and their friends, go and have it, because it'll keep us all safe.
Thank you, Minister Hazzard. Minister Ward.
Thank you so much, Jesusa. Yeah, I just wanted to add to that and say that it's been critically important, our partnership with religious and community leaders. We've had our weekly forums with each of those groups and with our NGOs, and particularly in those LGAs. And I have just wanted to say how much I appreciate the religious and community leaders conveying those messages, particularly when they've been vaccinated themselves. And when the Archbishop got vaccinated, he got a lot of feedback about that. I know that I can stand here as a politician and I can say go and get vaccinated, but when you hear that from your own leader in your community in language, it has a lot more effect. And I know that people trust their leaders and will listen to them. That's why it's so important, and we partner with them to ensure that we get that messaging out and that we update that regularly. So we've had those forums, we've dealt with each of those, and we've pivoted as we've come through the process and learned what works best. And we know for our younger ones, as I said earlier, that we've heard in language about the health messaging from the sports heroes and through the social media channels. But I was delighted to listen to Arabic radio the other day. I couldn't understand what was being said because I don't speak Arabic, but I could understand COVID-19, and I could hear that the health messages were being conveyed, and that was just magnificent. So I really want to thank the leadership groups in each of those communities for getting that message out far and wide to every corner of our communities in language.
Thank you, Minister. There's a question here. It says that the Premier said that New South Wales won't reopen until the vaccine reaches 80%. But the Prime Minister suggested the society would open earlier. Who should we listen to? What is our roadmap to reopening?
Look, they're both actually. They're leaders in one state, the Premier and the Prime Minister for the country. But they are all meeting, all the Premiers and First Ministers meet with the Prime Minister. They've all agreed that there will be, it'll be an incremental, step-by-step opening up. But certainly the first major starting point is when we get to 70% of all people in every state and territory. And then, of course, when we reach 80%, it'll be much more open. There might still be from time to time some very modest restrictions, I suppose, if we have 20% of the population who still aren't vaccinated. But that's going to be not anywhere near what it is at the moment. So the big ambition here is from both the Prime Minister and the Premier to get the 70%, then the 80%. I don't think there's any difference between them. That might have been just different interpretations of what they said. But I spent a lot of time with the Premier, and I'm often listening to what the Prime Minister says. It's no different. We need to get to that as soon as possible.
Thank you, Minister. Feta is asking, we have been asked if breastfeeding is safe after a jab of Pfizer. Could you please tell us if there is any medical advice, Dr. Chant?
Not that I'm aware of, that there's any problems with breastfeeding after that Pfizer, and we recommend breastfeeding, but I'll certainly clarify that and review that and get that information.
I think it's Hazzard to come out saying it's okay. Yeah, I think my understanding is that the specialist advisory group that advised the federal government, so these are the medical specialists and scientists, have said that the vaccines are suitable for women who are pregnant and women who are breastfeeding.
Thank you, Minister. We want to thank everyone for being here, and we also received some thank yous for having this opportunity for the media to be speaking to the ministers and Dr. Chant. They're saying that, do we have enough confidence that enough information is being provided in all language groups to Sydney communities? This is from Russell Anderson from NEMBC Media.
I'm sorry, can you say that last bit again?
The question is, do we have enough confidence that enough information is being provided in all language groups to Sydney communities?
No, no, I don't. That's why we value you in making sure that as much information gets out as possible. As we've said, we try to get out through community leaders, and in your roles, you may see yourself just as journalists, but I see you as journalists who are community leaders, because it's your words and your explanations that go out to the community, whether it's TV, whether it's radio, whether it's print media, whether it's social media, to try and get the messages out about how important it is to be vaccinated. It is truly our only path out of this 1 in 100 year pandemic. And we're very, very lucky to have vaccines. And as the Minister for Health, I have to say, I don't understand people's reluctance to have vaccines. We know in this country, and maybe in the countries that you've come from, polio was rife 50 years ago. Polio was everywhere. But now polio in this country has gone because of vaccines. We know our babies have measles vaccines, mumps vaccines, whooping cough vaccines. We know that's what gives us the quality of life we have in this first world country. We know now we have 2 very good vaccines that we need to get into our bodies to build our immune systems to fight this 1 in 100 year very clever virus. And unless we're all on this, unless we're all in it together, unless we can get people to come and join us in this journey, we will be stuck in this situation for far too long. So please, as leaders in your media areas, get the message out. Thank you.
Thank you, Minister. There's a question again. I'll go back to Vladimir from Russian community. Vaccinations is available now to all adult population. It's possible to increase vaccination 2 to 3 times, at least with AstraZeneca. And with certain groups of people in our community still contemplating about vaccination and others don't want to get vaccinated, would it be a good time to announce, say that in a month's time, quarantine will stop and businesses will resume with certain social distancing masks? And if those who decide not to vaccinate will take their destiny in their own hands?
Look, Vladimir, I don't think that our governments would think that that was the appropriate way to go. We want to take the community with us. We don't want to threaten them with removing quarantine or any of the other safety measures we have. So I suppose that's the beauty of democracy, that our government and the federal government want our community to trust us and to come with us. And so our focus is just trying to convince people of the benefit of getting vaccinated to save you, to save your children, your mum, your dad, your family, and indeed all of Australia. Thank you.
Dr. Chant, would you like to comment?
Look, I just want to say that that's not a tenable position to adopt. The loss of life and would be too great for our communities to bear. The course of action we need to do is adhere to the lockdown, push our vaccine coverage up as quickly as we can, but we're going to have to redouble our efforts. Also, I know people become fatigued, but we do need very strong compliance with those measures of staying at home And I think it's also important that you're aware of the social supports that are in place to support your communities. Isolate effectively, to also follow, access food and other services which are critical. So no, we can't do that. We need to hold the course, improve our vaccination coverage as quickly as we can.
We'd like to ask the question about information for GPs and pharmacies are providing vaccines, if there's anything that you'd like to add to that.
Of general practice, there's a couple of key messages for both general practice and pharmacies. If you've got COVID symptoms, please call ahead and make sure that the GP knows, because they might actually send you for a COVID test or assess you over the phone. And similarly with pharmacies, please don't go into the pharmacy if you've got symptoms, because we're having a lot of people access cough and cold medicines in the pharmacies and then exposing pharmacists and other health staff and other patrons. So we've done a lot of work with pharmacies to potentially even have screening at the front of the store, not allowing people in, and some other strategies. But it is really critical that we can access health services and never feel that you can't access health services, but we need to do that in a safe way.
Thank you very much, Dr. Chant. We only have 1 minute to go, so I guess we'll just wrap the questions. And we want to say thank you for being here. We'll just have one last thoughts from our ministers and from Dr. Kerry Chant.
Look, just again, thank you. And we'll do this again. I want to thank Minister Ward through her role as the Minister for Multicultural Affairs, and also Dr. Chant for all the work she's doing. But really, thank you to you, because you're the ones who can get the messages out to that very vibrant community that makes Australia great. So thank you very much.
Minister Ward.
Thank you so much, Jesusa. I just want to underline and emphasise Minister Hazzard's comments that you are absolutely critical to us getting out of this pandemic. I can't emphasise that enough. I just want to thank you for your partnership and again for these engagement opportunities. I love hearing feedback and suggestions, but also please make sure that you're applying for those multicultural media grants. We'd love to get that money out to you as quickly as possible so that you can be getting that critical messaging out to communities in language. Thank you.
Dr. Kerry Chant.
I just want to say thank you to the communities. I've had the privilege of working with the communities for much of my professional life, and it's one of the most happy times of my life. So thank you. And my heart goes out to the communities of southwestern Sydney and Western Sydney. I know the struggles and challenges that you've experienced, and that's why when I see that you have among the southwestern Sydney and Western Sydney communities have amongst the lowest vaccination coverage in the state, it means that you're highly vulnerable to the effects of COVID. And so please, I just say, go and get vaccinated, please.
Thank you very much, Dr. Chant. And thank you very much for all of you listening in on this Multicultural Media Online Conference. We'll make sure that this forum is recorded and delivered to you. It is found on the New South Wales Multicultural Health website. So again, the message is please get vaccinated. And if you're unwell, please get tested. Thank you very much. Stay safe and take care.